Welcome back. Welcome back to the morning show here on Tobago Updates Television. And thank you so much for staying with us. Listen, we have so much fun on this set, on and off air. It really is amazing. And I know sometime in the past, I mentioned to you, working in the media, it really, really is exciting. And so we really do have a good time. And we thank you so much for being a part of this journey with us. Today, as you are aware, we are celebrating nurses. It's Nurses Appreciation Week. And the conversation we had with the nurse earlier on, the registered nurse earlier on, really was, Miss Map, really was an eye-opener to us, Sometimes, Akinlabi, we really just see at the surface level.
Yeah.
We go in, as I mentioned before, you go into the emergency room, and they said you through triage, they take your information, and then you find that you're waiting. But if you look in the background, you see the nurses moving like ants.
Busy.
They're like ants behind there, running up and down here and there, trying to ensure things get done. And we really take things for granted. And one thing she said that really stood out is the fact that sometimes they work 12-hour shifts, and could you imagine being on your feet for 12 full hours?
Yeah.
What kind of shoes you have to wear, first of all?
No kind of padding could make up for that. No kind of padding could make up for the being on your feet for 12 hours, constantly moving, constantly caring for people, putting yourself on the back burner and caring for persons. That kind of sacrifice, I don't know if many people in this country could do it. I don't know if many people in this country truly appreciate the kind of work that nurses really put in to make sure that your loved ones, you or your loved ones, are well taken care of while you are at the hospitals, the nation's hospitals. And I think it's something we just need to put in the forefront of people's minds, that these nurses, even though the system itself may not be perfect, these nurses, these doctors, these nurses, these nursing assistants, they really sacrifice a lot for our well-being.
They really overextend themselves. And let's talk about a bathroom break. The bathroom break, nurse said sometimes you only get to use that bathroom once if at all, or you get to use it when you get home. Online with us, we have another nursing practitioner in the person of Giselle Pierre, and she's a registered scrub nurse working at the Port of Spain Gynecological Theatre. Good morning and welcome.
Hi, good morning.
Look at our nurse in her outfit, her work gear. Look at this. This is commitment, and we must say we really, truly appreciate you for taking this couple minutes to speak with us this morning. I know that the demands are high, and so we just want to say, first off the bat, happy Nurses Appreciation Week. We appreciate you.
Thank you very much.
Before we came on, we were kind of going through what we know, we just only know at the surface level. And we spoke with a nurse earlier on in the program as well, and she brought some enlightenment to us. And what I want to ask you this morning is, in terms of your role in the theater there, what are some of the demands? Because sometimes we take these things for granted and we only see nurses bringing the medication, the nurses, probably tidying up the patient, but there are so many other things that a nurse does. So what are some of the things you are called to do in your role there in the theater?
Well, first of all, working in the theater as a registered nurse, we ensure to be the patient's advocate, right? So we don't only look at the physical, we look at the psychological aspect. So when they enter into the theater, we have to ensure that they are relaxed and comfortable. Sometimes we take our time and pray with them, because, coming into a new environment, to come and do something as surgery is so frightening to them and overwhelming that we need to be at their side. So we are more than an advocate for them. And also we ensure that when they come into the theater, we take them through every step. We explain with them, and at the end too, if it is they are experiencing major pain after such major surgeries, we also speak up. We are the voice for the patients that cannot speak for themselves, and we ensure that they go to the ward in a comfortable manner and continue that ongoing nursing care on the ward. So it's a whole long process in the theater on a more psychological aspect. than physical.
I want to ask my co-host this. Akinlabi, did you ever think about the nurses being the advocate for the patients? I mean, I really did not even think about this aspect of it. Having to speak up and she mentioned praying, and
Yes.
walking through the paces with the patients and that level of
Yes.
support.
So
Wow.
I
Yes.
never thought of them as an advocate for the patient. This is the first time I'm hearing about that, but also just hearing that the nurses also have to be a friend, a counselor, a prayer partner. All these things
Yes.
nurses have to do is really amazing, the amount of work that you all put in. But nurse, just tell us, what does a day in the life of a nurse in the gynecological theater look like?
Well, first to begin, we start off work at 7 a.m. We prepare the area for the surgeries during the day and also for emergency surgeries, people that, have got into injuries during the course of the day and just abruptly come to the hospital. We prepare that, we ensure that everything is sterile to maintain sterility to prevent infection during the surgery cases. We ensure that the patient is psychologically prepared, and that psychological pace is maintained throughout the theater, throughout their procedure, even after the surgery. We also ensure to have these instruments and supplies readily available for whenever a demand for surgery is needed to assist to any surgical cases, right? We ensure that we liaise with the superior one, our supervisors, in case that it have infrastructural damages. We ensure that it's a multidisciplinary action that theater nurses does. We don't only study surgery. If anything is wrong with the structure of the building inside our department, we have to ensure that that is maintained, ensure that we not only look out for the patients, but we have to look out for ourselves as well. And that protocols is maintained so that patient can have pain-free and reduce of infection post-operative ongoing care, even when they're at home. And when they return to the hospital for clinic appointments, we ensure that 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 aseptic technique, that sterility, that reduce of infection is maintained until they are comfortable enough to go back out to work. So it is not just preparation for surgery. We gear up ourselves to prepare on a teaching level as well as a physical and psychological level to ensure that the patient can return to work and perform as they used to before the surgery.
Now, Nurse Pierre, I know that this particular aspect of nursing is a selective. How did you decide to go into this aspect of nursing and not general nursing? And how long have you been serving as a theater nurse?
Well, first of all, I'm a theater nurse for 18 years. I have I have been exposed to all type of surgery, kidney transplant, cardiac surgery, organ harvesting. So it's all different types of surgeries, and also you have to be, when you pass out as a normal registered nurse, because I am a registered nurse before I'm a theatre nurse. So I worked on the normal wards, what we call bedside nursing, right? And I was there for 2 years, and then the government or the institution, which is Northwest Amanda, Northwest Regional Health Authority, they provide post-basic courses, and they advertise for the nurses to upgrade in their area of nursing. So you just have to wait for the advertisement and apply, and you can get through and do your studies.
Nurse Pierre, you mentioned earlier that your shift starts at 7, you have to come and prepare the theater for surgeries. But after all those
Yeah.
hours of preparing, you then have to be present in the surgery, and those surgeries could go pretty long. How long does a surgery could take? Sometimes, what is the longest you've ever sat down in a surgery after you've done all the work to prepare for that surgery?
Sometimes the longest I've stayed in a surgery for was 12 hours.
Ooh,
Wow.
what type of surgery was that one?
That was like a gastric bypass.
Okay.
Wow. And during those 12 hours, I mean, I can't comprehend. I mean, we watch television, we watch all the doctors and nurses shows, and we kind of see just the basics. But what is it like spending 12 hours in a surgery, in a theater, while a surgery is being performed?
Well, we thank God that, you know, it's not just me alone, that we can interchange and have little breaks in between. And it is tiring on your body. So tiring that when you reach home, you know, you have to decompress. Sometimes you just want to stay a little while by yourself, take a little longer time in the shower just to, you know, decompress, and then you can attend to your children at home or your family at home. So it is tiring, but we had to ensure that we maintain a good mindset, and our mental is you know, it is focused, and that we don't make mistakes. So you always have to be on your toes. You know, it is, you can't, we have to overlook the tiredness.
You know, and this is a lot, and I thank God for people like you who have the heart for this type of job, who love what you're doing, because the nurse Map we spoke with earlier and yourself, I'm hearing the passion and the commitment that you have to the type of service you provide. For you, what is the most rewarding thing in being a nursing practitioner?
The most rewarding thing is when I see that, you know, you give up your effort and you could see that the patient walks out of the hospital, and they are you know, in a good spirit and happy that they did it, because of coming into the hospital, you know, they were having complications, so they were in pain and grimacing, and just to see that full transformation that you were a part of, because as a nurse, we know that we are a team player. No one is their own island. Everybody have to come together and, you know, to make something happen for one individual. So it is rewarding to see that, you know, the camaraderie in your department or in nursing, that we all have to come together to just help one person, and it forms bonds and relationship with your co-workers, and also to see that patient saying thank you, that alone is rewarding for me. And it also, you know, rewarding to see that I can also assist myself and loved ones because of the knowledge that was gained in nursing.
All right. I mean, this is a lot, and I really wish we had more time to go
Yes.
through this. But I must end by saying that honestly, this show this morning gave us so much insight into the demands, and we really, really appreciate you. My attitude towards nursing, not that it was bad before at all, it was never, but my attitude towards nursing practitioners is changed. I'm not saying it's going to change, it is already changed. So whenever I interact with someone, whether on duty or off duty, the nurses I know in my life, listen to me, I am going to give them so much love because of all that you do for
Thank you.
us. Right? Because of all
Yes,
that you
thank
do for
you.
us, the people here in Trinidad and Tobago, we really have to show gratitude, because I know you could go into a hospital, you could go into somewhere to do a surgery and just get the basic care, and that will be sufficient. But based on
Yes,
what you are saying, the things that you put into ensuring the comfort of patients, to ensuring that the families are even, you know, they also feel comfortable knowing that the surgery is going to
yes.
go through the paces and stuff like that. Listen, nurse, thank you, thank you,
Yes.
thank you, so very
Thank you
much.
very much.
We really do appreciate you, and we hope that you could find some time during the day just to relax, as you said, decompress, and pat yourself on the back for the good work that you're doing. You are doing good,
Thank you.
and may you continue to receive the grace to do all that you have to do as a nurse, wherever you are. Thank you so much.
Thank you very much for having me.
Of course. Ladies and gentlemen, we've been speaking with Nurse Pierre. Wow, 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 wow. Nurses really give of themselves, and we must show them that measure of appreciation. Before we go, we have to go back to the photo of the day. Were you able to guess where this photo was taken from?
Well, if they can't guess this one, something wrong.
We have to take back your passport. We have to take back your passport.
If they can't guess
Come
this
on,
one.
somebody. Tell me where this photo was taken this morning. Marvin Clark, we say thank you so much for sending in this photo for us this morning. This is the iconic Pigeon Point, and so beautiful photo. This is Tobago, beautiful Tobago. So just in case you're wondering, if you're not here, you need to get on a plane and get to Tobago to experience the beautiful Pigeon Point and all the other beaches we have here on the island of Tobago. Thank you so much for staying with us throughout the entire program this morning. This is where the morning show ends, but our programming continues with GMT, that is Good Morning Tobago. So do stay with us, and as you stay, we invite you to help us.
Share the live, share the live, share the live.